When patients come in, they are often at a place of feeling defeated and having lost control. So one of the things that I think this practice does really well is instill a sense that they do have control, that they do have choice, that we are not going to ascribe what they need, that they are actually a part of all treatment decisions. They're a part of the assessment process, they're a part of the diagnosis process, and they're an integral part of the treatment process. They are here to really co-create the treatment plan, and they're as valuable as a team member as other staff people are. It's not a privilege to make decisions around your treatment. It's actually our clients' rights, and we support that to the end.
So in many ways in Recovery Without Walls, we're trying to expand the number of choices that's based on scientific evidence, that's based on a humane assessment of a patient's problem, that's also based on a medicalization rather than legalization of the problem.
Oftentimes when patients come to our practice, they're really scared and they've been to multiple treatments and they felt that they're not being able to be helped, and they often don't have a lot of hopes but feel like we're the last resort.
The practice of Recovery Without Walls is different because it's really client-centered. It's based on what a person needs at a given moment. It's not based on diagnoses. It's based on active and fluid symptomology that's being treated in real time. The biological symptoms, the psychological symptoms, the social symptoms, influences of outside factors to address a person. There's not one way to treat a disorder. There's not one way to treat a symptom. There's not one prescription. So I think it really takes into account what a person needs from the inside out, not just what we view and diagnose from the outside in.
Community of healing often means having access to a larger supportive network. Patients who are in early recovery really rely on the recovery community and the family members.
We offer them the nitty-gritty of direct engagement, of dealing with their withdrawal, of finding the right medicines, of not being constrained by a cookbook or a textbook description of how to treat addiction. We look for what's called a virtuous cycle. We all know what vicious cycles are. We all fear that and get panicked. But there's the other side of the coin, that if we fix one little part of you and make that better, then that'll make the other part better, and that will make the other part better.